But because of the nature of his evidence and the likelihood that he may mention matters which could potentially identify him, there will be no YouTube and there will be no live stream. So those who are watching online, I'm afraid you will not be able to access that evidence, though of course there will in due course be a transcript. You'll appreciate, those of you who are here, that I'm saying that for the benefit of others, but they're likely to number rather more than we have in this room, sizable though today's audience is. Now, in a moment or two, I'm going to ask Sapna to invite each of you in turn to take the oath, and then Ms. Richards will ask the questions. If at any time you want a break or you want people to speak more loudly, because I think, Linda, you may have some difficulties of hearing on occasions.
Yeah, I've just turned it up a bit.
And you can hear me all right, can you?
I can hear you better now. Yeah.
Right, well, we'll take it slowly, I hope, and if I ask anyone to slow down, it is so that you can follow and haven't to strain too much. So, Sapna.
Please state your full name.
Elizabeth Mary Buggins.
Repeat after me. I do solemnly, sincerely,
I do solemnly, sincerely,
and truly declare
and truly declare
and affirm that the evidence I shall give
and affirm that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Thank you. Please state your full name.
Brenda Haddock.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the
and
truth.
nothing but the truth.
Please state your full name.
Christine Linda Walliscroft.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence that I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Now, Linda, we know from what you've just said that your first given name is Christine, but you are normally known as Linda.
Yes.
I'm going to start by asking Elizabeth some questions. Elizabeth, you're here to talk about the treatment of your 3 sons at Birmingham Children's Hospital.
I am.
And your first son, Richard, was born in 1978.
He was.
How did it come about that Richard was diagnosed with
Well, and the GP referred him to the local hospital, who then shipped him from where we lived near Birmingham up to Alderhay Hospital in Liverpool with a police escort and staff on board because he was so poorly. And there was something wrong with his brain, but they didn't know what. And it took 3 days for Richard to be scanned. And then they realised that he got a lot of bleeding in his brain, and there was so much blood they couldn't see where it came from. So they operated and excised a large part of his brain. And he just about pulled through and began to get a little bit better. And then a following week, I recognised the same look on his face as a week previously. And so they scanned again and realised that he'd bled again. And they took him back to theatre. He was very, very, very ill, obviously, at that point. And I think the second bleed had resulted from a subdural tap, which they'd done at Alderhay before moving him to Walton Hospital. And it was only 2 days after that, when it looked as if it was happening again, that I was told that Richard had been found to have severe haemophilia. and that was the cause of the bleeding. It wasn't an aneurysm that had broken or a cancer which had tapped into a major blood vessel in his brain.
And Richard was left with some cognitive and physical difficulties following the events you've described.
He was. When he came back from Liverpool, which was 4 months later, he was more or less paralysed on one side. His sight was very, very poor, but he could hear. And the joy for me was that every time I went into a room where he was, he put his hand up. And he was always pleased to see me.
You had two further sons, Jonathan and Edward. Jonathan born in 1980. And what year was Edward born in?
1981. Yeah.
And they too were diagnosed with severe haemophilia A.
They were.
Did you have any family history of haemophilia that you were aware of?
None. And we can go back many decades. Nobody has any sign of haemophilia. But once genetics came along, it seems that I'm the start of the tree rather than having a history.
We've got some photos of the boys that we'll just show at this stage of your evidence. So if we could have those up on screen, please, Lawrence, Elizabeth's photos. So
this was Jonathan sitting on the homemade truck, and Edward, his younger brother, pulling him. And it's probably about the age Jonathan was when he acquired HIV. And this was Richard, probably about 4 or 5 years into his life, yeah. And this is the 3 boys a few months before Richard died.
And then we've one more photo which shows your...
And then after Richard died, I had a daughter. And she was quite keen that I showed this photograph because it shows how young I was.
Thank you, Lawrence. So the ongoing care of Richard, Jonathan and Edward's haemophilia took place at Birmingham Children's Hospital, and the consultant was Dr. Frank Hill.
It was.
Your husband was working full-time. You had been working in the health services in a managerial role, a role you later went back to, but you gave that up to look after the children at this point in time.
I did.
And so, as a result, you were dealing with the vast majority of the hospital appointments and the treatments.
I was.
And so, with 3 children with haemophilia A, were you at the hospital a lot?
A huge amount, yes. I've lived there for a month at a time because Richard had, he was a high responder inhibitors with factor VIII, and so the bleeding was very difficult to control.
Richard was treated from a very young age with factor VIII concentrates.
Yes.
Do you know in Richard's case whether they were commercial concentrates, NHS concentrates, or a mix?
I think they were almost exclusively, well, I know they were almost exclusively American concentrates because he needed so much volume of treatment.
And we'll look shortly at when Jonathan began to be treated. But at this point in time, with Richard being treated and then Jonathan, what, if anything, did you know at the outset about risks of transmission of viruses from the concentrates?
I don't remember anything from the outset. We were just hugely relieved that there was something that could stop this bleeding that was so traumatic for Richard. Once we arrived at the Children's Hospital, and I don't know which year this was, it's just too long ago, but somewhere I would say between before 1984, I remember having a conversation about the risks of hepatitis in factor VIII, and that there was more of a risk with concentrate, although I never remember that being quantified. But that was the extent of it, really.
And at this point in time, in whichever year it was in the first years of the 1980s, were you told anything about the seriousness or otherwise of hepatitis?
No, I don't think so. It seemed a much lesser risk. And it wasn't really talked about explicitly until, I think, 1985, when the boys were given hepatitis B vaccine.
Now, Jonathan began to be treated with concentrates also at a very young age.
Yes.
And we can pick that up from a report from Professor Savage, which details Jonathan's treatment. So, Lawrence, could we please have WITN 1021004? If we go to the second page, we can see it's a report concerning Jonathan's treatment. It's dated, this is on the last page, we don't need to go to it now, 2nd of June 1992, from Professor Savage. And is it right to understand this was a report prepared in the context of legal proceedings that you were bringing against the Health Authority?
It was.
We can pick it up towards the bottom of this first page on the screen. There's reference to Richard and the complications of inhibitors. And then we can see the last 10 lines or so on screen. This says in relation to Jonathan, the child experienced his first clinically significant hemorrhage on the 13th of February 1981 with a bleed into the left ankle joint. He was treated at the hospital with 3 packs of cryoprecipitate with good effect. On the 27th of March 1981, the boy sustained an injury to the left leg with bruising of the upper third, and from treatment records, it would seem that the child was given 234 units US commercial factor 8. And just pausing there, just to get a sense of it, and without giving details of dates of birth, Jonathan would have been in the region of a year old at this point in time. And so Professor Savage continues as possible. As cryoprecipitate treatment of infants was the recommended policy of the hospital and indeed nationally, the administration of this large donor pool commercial material in preference of cryoprecipitate or NHS concentrate without authorisation was negligent. There's then a reference to a further administration of Armour factor 8 concentrate in March 81, another one in May 81, and Professor Savage continues, and this is 5 lines from the top, as before, there is no evidence that authorisation was given to depart from hospital policy, and it is remarkable that a different batch of US material was given. There's then a bleed treated with cryoprecipitate, and then a similar bleed treated with Armour concentrate, further details of Armour concentrate being given, and then further occasions in which Jonathan was treated with cryoprecipitate. And if we look towards the bottom of the page, yes, I'll pick it up about 7 lines from the bottom. Professor Savage says this: on many of the occasions when cryoprecipitate was given, the patient was not admitted to a ward, indicating that convenience of administration of factor 8 concentrates over cryoprecipitate, possibly obviating IP admission, was not a cogent argument for their usage. During 1983, the boy was treated on 26 occasions exclusively with Armour factor 8, both as an inpatient and outpatient. During this year, 9 different batches of the Armour product were used. During 1984, the boy was treated on 17 occasions, initially until, and then there's a date in May, with Armour, and then exclusively with NHS factor 8. And it suggested that was due to an allergic reaction to Armour in May of 84, and then in 1985, only NHS material was used. We'll come back to the issue of the HTLV3 testing, but if we just look further down the page, we can see Professor Savage expressing an opinion about the way in which Jonathan had been treated. He says, just above the heading 1, use of large donor pool US commercial concentrates, we'll see that Professor Savage says there are several issues in this case which are divergent with established clinical practice. 1, use of large donor pool US commercial concentrates. And we can see that Professor Savage reiterates that cryoprecipitate would have been the recommended form of treatment. And top of the next page, he explains why when he says cryoprecipitate was of particular benefit in such cases since it was derived from single voluntary donor plasma collections in the UK and thus carried a substantially lower hepatitis B and non-A, non-B hepatitis risk. And he explains then further down, about 12 or so lines down, factor 8 concentrates, on the other hand, and particularly US commercial material from paid donors, were derived from large donor pools, and then he gives some figures, and imparted a substantially higher risk of hepatitis. So that's the first observation Professor Savage makes. Over the next page, picking it up about 6 lines down, he says in relation to the administration of Armour Factor 8 in March of 1981, no explanation whatsoever was given as to why cryoprecipitate or even NHS Factor 8 concentrate were not used, or even if they were not available in the hospital at the time. Furthermore, there's no documentation as to whether advice in the choice of therapeutic product was sought from a senior colleague, or whether authorization was requested or given to administer this US material. Treatment of the child with US product in view of the prevailing recommendations and hospital policy, the lack of suitable documentation, and in the absence of authorization was negligent. And towards the bottom then of the next page, I'll just pick it up in the last few lines. Having described the ongoing use of Armour concentrates, Professor Savage says this in the last 4 lines: this policy was pursued with no reference to the availability of NHS concentrate at the hospital in the face of growing concern and increasing information in the public and medical press that AIDS was transmitted by blood products. And then if we go to page 9, last of all, there is this observation from Professor Savage: it would seem that Armour was the sole supplier of commercial Factor 8 to Birmingham Children's Hospital at that time, and Dr. Hill was purchasing large amounts of low unitage vials at any one time. However, instead of allocating an individual small group of patients on any one batch to ensure long-term continuity of management of such cases on the same batch, it would seem that, with a few exceptions, the vast majority of Dr. Hill's patients received the same batch over a few months until the batch was used up. This rather bizarre approach to patient management resulted in the child receiving a relatively large number of batches of vials of material containing few units in a remarkably short time. The therapeutic management of this child during 1981 to 84, but particularly during 1981 and 1982, was negligent, and undoubtedly the ill-conceived use of Armour Factor 8 must be held responsible for the infection of the child with the AIDS virus. So that's Professor Savage's report. And we can see from this that Jonathan was treated sometimes with cryoprecipitate. It would appear perfectly satisfactorily. Is that your recollection? But then treated with Armour Factor 8 for no obvious reason.
Yeah, it's interesting that there's one thing in that report which is contrary to what Dr. Hill said was his policy, told me was his policy, which was that children were kept to the same batch wherever possible, which doesn't seem to have happened in this case. And the only way I can explain it to myself is that I think it was Sister Marion who consistently gave cryo, although I haven't been back through the records to check. But out of hours treatment, the management of junior doctors and their prescription of treatment seems completely random.
We're going to come shortly to a meeting that you attended at the hospital in, I think, 1984, late 1984. But before we get to that, had you at any point during these years been given any advice or information about the possible risks in terms of transmission of AIDS?
No.
Edward's treatment at this time, I think, was with cryoprecipitate. Is that correct?
It was, although he did have a mix of treatment in his early life too. I have a little information about that. Yeah, so I don't think there's a different pattern.
Now, so a meeting then took place, and I think, doing the best you can, you think it was the autumn of 1984.
Yes.
What can you recall about that meeting?
Well, I remember there were a lot of parents there. That was it was a sort of overwhelming walking into the room and seeing how many people were affected. And I can remember still where I was sitting in relation to the platform. You know, there's some things that are burnt on my mind. And we were told that there was sort of a preamble about HTLV3 and what it was and what the understanding was from Dr. Hill at the time. And I think there was a few others from his team there, but I can't remember who. And he told us that they had been testing the stored samples, of which they had many because they'd been doing research on other issues to do with immunosuppression, and that they knew which boys had acquired HTLV3 and which hadn't. But my memory is quite clear that they encouraged us not to ask unless we felt we really needed to know, because they were worried that we would treat the boys differently if we knew that they had HTLV3, and that wouldn't be good for them.
So is it right to understand that the message you recall is that as parents it would be better not to know?
That was what I took away from it. Yeah.
And you put it this way in your statement: we were invited to ask for a personal meeting with Dr. Hill if we wanted to know whether or not our children had HIV. However, we were discouraged from asking, as he said he was concerned that our knowing of a positive diagnosis would change our relationship with our child. There was no treatment and nothing could be done about the results.
Yeah.
Now, a few days after that meeting, you went into one of the treatment rooms and you saw a list of names on the refrigerator. What can you tell us about that?
I'd taken one of the boys in for some treatment, and it was a very small treatment room with a couple of big fridges in, my colleagues will remember. And on the tall fridge door, there was a list pinned to the outside of the fridge door with a list of boys' names on. And because I had spent so much time over the previous few years at the hospital, and most of the boys weren't on prophylactic treatment, so they were there too, I knew which boys were big users of Factor VIII and which weren't. And I had understood from the meeting that Richard would have been infected with HTLV3, as it was, because of the volume he was getting through. I think he had over 450,000 international units during his short time at the Children's Hospital before he died. And when his name was there, that sort of confirmed that might be. But then I saw Jonathan's name, and that was completely unexpected.
And what you understood this to be a list of the boys who had
Who were
tested
positive.
HTLV3?
Yeah, I was pretty certain. So I then asked to see Dr. Hill.
And what did Dr. Hill tell you?
He told me that both boys were infected, but Edward wasn't.
And Edward's name had not been on...
It not been on the list.
Is it right to understand that you hadn't been aware before the October meeting that there was testing being undertaken on the boys?
It's a difficult one. That I don't think I knew that it was tested. There was testing going on. It didn't surprise me when we were told they had been tested, because there was frequent blood tests being taken. Quite often that we didn't know what they were being taken for, and repeatedly of about 100 mils, which out of little boys is quite a lot, because there was research going on in the unit. And I was comfortable with that because I wanted them to find out how to make things better. But we weren't told what they were being tested for.
So you knew the blood was being taken, you knew there were a variety of tests, but you don't think you were specifically told and invited to consent to an HTLV3 test?
No, I'm almost certain of that.
How was, when you were told this by Dr. Hill, do you have any recollection of how the information was communicated and the extent to which you were given advice or guidance on what to do?
In that initial meeting, no. I think the emotions just were enough to take out without carrying a lot of information out with me. I don't think there was much information available at the time. Certainly the only advice we had was at home to wash everything in the hottest possible wash and use a 10% bleach solution, which was completely impractical in a household setting, because you don't live in a hospital environment at home, and I had little boys and home furnishings, and I even went back and asked what to do about that and was told that it wasn't important.
You've learnt from the retrospective testing of stored samples that were undertaken that Richard was infected in all likelihood between August and November of 1983, is that right?
Yes.
And that Jonathan was infected between February 1981 and May of 1983.
Yeah, so that first armour transfusion may have carried the virus when he was 1.
And as you described in your statement and referred to a moment ago, you had particular concerns about how to manage in a home environment with, at that point, 3 children, one of whom, of course, was not infected with HIV, and in circumstances in which, is this like Richard in particular, had very heavy bleeds, so there would be blood in the home environment?
Almost every morning Richard had a nosebleed overnight, and he'd wake up with a cow pat of blood on his pillow, and it would all be matted in his hair and face. He used to drink from a feeder beaker and put it down, and his smaller brothers would pick it up, with blood trickling down his face from time to time. So we lived in an environment where if HIV was easy to transmit in a family setting, it would be likely to be transmitted in ours.
Again, just picking up on the evidence you gave a minute or two ago, you say you recall going back to the hospital, this is in your statement, and asking if Purcell would kill HIV. And the nurse said there are far more important things to research than that.
Yes.
You've said in your statement that the nursing sister was very helpful.
Yes, Marion Gregory was an absolute treasure. And I think, I don't know how I would have coped with these particular 3 small boys and their difficulties had it not been for her. The boys called her Auntie Marion, and she had a cupboard full of toys that were refreshed all the time, so the boys went to the hospital to see what the new toys were rather than for treatment, and in that way just normalised our experience to an extent, as well as giving me huge personal support.
And then in that time, after you had learnt that both Richard and Jonathan had been infected with HIV, so October 84, over the next couple of years, to what extent did you have ongoing dealings with Dr. Hill prior to Richard then becoming ill and the last couple of weeks of Richard's life?
Dr. Hill was a very assiduous doctor, I would say. We had, and I used to be annoyed about it at the time, he used to have quarterly outpatient appointments for all 3 boys that would always run over. And to manage 3 boys in an outpatient clinic setting, especially one with disabilities who I couldn't keep in his wheelchair, was really hard work. And I thought, because we were being seen at the hospital so often, it was more than was necessary to keep a tab on what was going on. So we saw him often. And when Richard was in hospital, he would be there all hours round the day and night, weekends and weeks. So we didn't have any lack of attention.
At the end of April 1986, Richard became very ill, and he was admitted to hospital. And is it right to understand the thinking was that this was HIV and that Richard was dying from AIDS?
It was, yeah. It was a bit early. They couldn't find a reason for his unconscious state. So Dr. Hill had heard about a patient in France that had toxoplasmosis of the brain as a result of HIV infection. And his thesis was that was what was happening to Richard.
Richard was then in hospital for about a couple of weeks.
Yes.
And his condition deteriorated.
It did.
And then he died mid-May 1986.
Yes.
You've described how he was during those last couple of weeks in your statement Is there anything you want to tell us about it? It's entirely a matter for you, the extent to which you'd want to talk about it or not.
It felt very unreal at the time because Richard had been so desperately ill through brain beads and encephalitis and so on through his life, that it wasn't really until some months after he died I emotionally accepted that he wasn't coming back. But the hospital looked after us really well through that period. I think he was the first child to die, thought to be dying with AIDS in the hospital. We never felt that there was anything untoward about them caring for him. So gloves and aprons and masks would be worn, but never spacesuits. People would come in and talk to us without gowning up. It was exemplary the way they looked after us.
But the trauma of Richard's death was exacerbated by events in the immediate aftermath of the death.
It was.
Can you tell us about that, Elizabeth?
Well, the Children's Hospital at the time, it's since moved, didn't have facilities to do a post-mortem on an infected child. And so they needed to use the facilities at the coroner's office. So Dr. Hill got in touch with the coroner and asked to do the post-mortem there. And the coroner, in Dr. Hill's words, became very excited at the idea that an HTLV3 positive boy had died on his patch. And he released a statement. Richard died at 10 to 9 in the morning. And he released a statement to the press, the coroner, that morning before the post-mortem was done, to say that a child known to be HTLV3 positive had died and thought to have died of AIDS in Birmingham Children's Hospital. The media loved it at the time because it was still a very stigma-oriented illness, and so there was a feeding frenzy around the fact. And because Richard, boys with haemophilia don't die every day when they're 8, and Richard's age was given, everybody who knew us knew that Richard had HTLV3.
And we can see, if we just look at WITN 1021009, we go to the second page. We can see some examples of press reporting. We don't need to look at the text, but the headlines tell us the story. Hospital AIDS probe on little boy's death, AIDS theory over death. And then there's what effectively is then a correction, AIDS virus not to blame, because as I understand it, the post-mortem revealed that Richard had died of a bleed on the brain.
It was a clot down in the stem of his brain, yeah.
We can take that down, thank you. How did the boys' schools react to their infection? I think you had a range of experiences.
I did. All 3 boys were at different schools. Richard was at a special school, and his head teacher had lost her child at 15, and so phoned when she heard Richard had died, with sincere condolences. It was about midday, and then when the first edition of the lunchtime news came out, she phoned me back and was so abusive on the phone that I put everybody's lives at risk in the school, because I hadn't told them for very good reason, which I do mention in my statement. I just had to put the phone down. It was just shocking. And then Jonathan's school didn't say anything. But the headmaster asked me some weeks later if Jonathan was all right. And I thought I knew what he was asking me, but I answered the question he actually asked, and I said, yes, he's fine, because I didn't want to talk about it, and I didn't think it was necessary because he wasn't bleeding at school. And Edward's school, the headmistress got in touch with me and said the parents had been asking questions and were quite concerned about having Edward in the class, whether it was safe for their children. And she agreed with me what she should say and that she should call a meeting to the parents. And it completely calmed it down, and they wrote to me a lovely composite letter and sent a donation to Richard's Memorial Fund, which, so you couldn't have a wider range of responses really in one town.
More broadly, how did you as a family experience the stigmatising effect of AIDS and HTLV3?
We didn't really feel the stigma too much. I mean, it was a frightening thing, and we knew we wouldn't talk about it outside a very, very tight circle when we first heard about it. But it wasn't difficult for the family, really, because our friends were fabulous until the publicity. And then everything changed. Because the play dates just stopped coming for the boys. We'd send invites out for boys' birthday parties and nobody would turn up, or one or two. The school stopped stimulating Jonathan, and he was a bright, very, very capable boy, and was just allowed to daydream because they felt sorry for him. Edward's mental health was really, really badly affected by Richard dying, and there was no help at all for that. And immediately on the death, the media were trying to find out from the hospital who we were, and we got these little boys who were 4 and 6. So we went to friends on the south coast who provided us respite for 2 weeks while the media frenzy died down. And thereafter, we moved the boys' schools to a primary school 10-ish miles away, where nobody would recognise our history, and they could carry on their childhood as normal.
And you also observe in your statement that there was there were known to be a number of other children treated at Birmingham Children's Hospital also infected with HIV, and obviously we'll be hearing further evidence about that today. And then there would be deaths and funerals.
They sort of increased, they sort of stepped up the frequency of them. And because we as parents knew each other very well, we went to the funerals, and it just felt like there was this wave of death. And every time I went to a funeral, we would all be in tears, and we would be anticipating our own children dying. But there was quite a lot of mutual support between parents who were in that group, which was very helpful and continued for a while.
Just one observation, if I pick up on in your statement, I'll just read a paragraph from your statement. You say this: "One question in my mind is what incentives, if any, doctors were given to limit product use or to use a particular product. On one occasion, I remember a set of white leather suitcases appearing in the treatment room, and someone mentioned that these had been provided by a drug representative. I wondered what really influenced treatment choices."
It's still a question. I don't know the answer.
Now, Jonathan, at this point in time, when Richard died, he didn't know his own diagnosis.
No.
And it was a few years later, I think when Jonathan was about 10, that you decided that he should be told. And your husband told Jonathan the position. You described that as, I think in your statement, watching your husband and Jonathan in the garden, how agonising that discussion was.
Yeah, Jonathan had started to ask for grown-up conversations, and we knew we needed to tell him at some point. And there was stuff around in the media that Jonathan was picking up, and so we decided it was probably the best time to tell him before he got into adolescence. And so, as one of these sort of man-to-man conversations he was asking for, Phil took him into the garden and had a chat about it.
But before I ask you a little more about Jonathan and Edward, you brought litigation on Jonathan's behalf against the Health Authority. And that went, the global HIV haemophilia litigation having settled, and the inquiry's heard evidence about that, the individual case against the Health Authority actually went to court.
It did.
You gave evidence to the court on the second day of the hearing.
Yes.
And on the third day of the hearing, Dr. Hill was due to give evidence. But what happened before Dr. Hill gave evidence?
Well, first thing in the morning, my QC approached me and said that they'd had an offer to settle with the Children's Hospital. And he said it was a total gamble because he had no idea how Dr. Hill would respond to questions. And the settlement that they'd offered was £75,000. And my intent in taking the action was really to make sure that Jonathan could have a home if he was to be lucky enough to grow up. At that point, £75,000 would have been enough to have bought him a small house of his own. So I decided I'd achieved my objective, and because we were so hugely dependent on the Children's Hospital for treatment, and I respected Dr. Hill at that time, and I didn't want him to be cross-questioned. I wanted to protect that relationship. I decided that we should settle, and so he was never cross-questioned in the High Court.
We'll look in a moment at the statement he provided for that litigation. Just before we do that, however, can I ask you about something you say in your statement? It was a time later you or the family encountered someone who'd also worked at the Children's Hospital in a more junior capacity.
Yes, well, it was my father-in-law. He used to repair antique clocks as a hobby after he retired. And he went to a house near to where he lives, and the owner of the clock said to him, "Are you related to Elizabeth Buggins?" And so he said yes. He said, "I was a junior doctor at the hospital when Elizabeth took the court case, and she should never have settled." Now, I only have that from my father-in-law, so it's second-hand information, and I've tried to find the doctor concerned, who I think has retired since. But he told my father-in-law, so I understand that he went abroad to work because he felt so uncomfortable about the way treatment was managed.
And the reason he thought that you shouldn't have settled for that sum, because in reality Jonathan should have been awarded a much greater
Substantially
sum.
more, yes.
And then again, just before we look at the statement from Dr. Hill, not long after, so 1993, and you've told us you one of the reasons you also thought favourably of the settlement offer was you didn't want to impair the relationship with Dr. Hill because you had two children who continued to be treated under Dr. Hill.
Yeah.
But you then got a letter from Dr. Hill refusing to continue to treat the children.
Yes, it was very early in 1993, so the year after the court case. And he asked us to take our children for treatment to another centre.
And did he explain why?
I have copies of the letters at home, which I could supply, but I don't have that in my mind. I know there was some allegation made, I think, by my lawyers, that there was a note in Jonathan's notes, a handwritten note, that looked as if it may have not been added contemporaneously, and that really upset Dr. Hill. And there's a letter back from me following Dr. Hill's letter saying, "I'm really sorry that that allegation was made." And then I spent the next year trying to persuade him that we still did trust him, because it turned into an issue of how much did we trust him to treat the boys, and I think how much he trusted us. And I involved a huge range of people, because having worked in the health service, I knew how the structures hung together. So I went first to the hospital management and asked them to intervene and mediate. I then went to the local area health authority. Dr. Bernard Crump was the lead there. He refused to get involved. The Children's Hospital supported Dr. Hill and said, "No, you have to find somewhere else." I went to Professor Rod Griffiths, who was the Regional Director of Public Health, and I think the regional arrangements held the doctors' consultants' contracts at that time. And he worked with us really hard to try and mediate and make arrangements. But by the Christmas of that year, so a whole year, we hadn't had outpatient appointments for the boys. We had emergency treatment only. And I'd arranged through my professional contacts for the HIV specialist at Heartlands Hospital to do blood tests on Jonathan so that we could keep track of how HIV was affecting him under a pseudonym so that it wouldn't be recognised. Yes, that was a hugely difficult time, and because we weren't on prophylaxis, we were at the hospital every few days, and I couldn't imagine with 3 children, because Rosie had been born by that time, how we could manage going to Liverpool or Oxford, which was where we were trying to be persuaded to go, and still manage any sort of life or any sort of education for the children. And so I felt completely stuck. And because Dr. Savage had done the expert report, and we came across the clinical nurse specialist from there at our Haemophilia Society conference, it was suggested that we should go and see Dr. Savage, which we did. And I thought it was going to be really, really hard to manage life like that, and we'd probably need to move house. And in actual fact, because they had prophylaxis, because the factor was delivered up to our house, because they only wanted to see them every 6 months, life became substantially easier and much less painful and traumatic for the children.
So I'm going to look now at the statement that Dr. Hill provided in Jonathan's litigation. And as well as dealing with aspects of Jonathan's care, it is Dr. Hill's perspective on his approach to treatment, and therefore of wider interest and importance as well for those whose children were treated at the Children's Hospital. So Lawrence, could we have WITN 1021024? We can see it's a statement from Dr. Hill. The date of the statement is April the 11th, 1992. That's later in the document. He gives some background about the paediatric centre. Paragraph 2 refers to it being the largest paediatric centre for haemophiliacs in the country, between 50 and 70 severe haemophiliacs registered. And then he describes regular medical cover being provided by senior house officers in paragraph 3. And then if we go to the top of the next page, there is reference at the top of the page to the quarterly assessments that you've referred to, Elizabeth. And then he says this: the treatment policy of the unit was to provide a treatment service that allowed replacement therapy to be given as early as possible to treat spontaneous hemorrhages so that potential short-term and long-term damage to joints and muscles could be minimised. Our means to do this was dependent on supplies of factor concentrates. With regard to haemophilia A, the factor concentrates available for use were cryoprecipitate, NHS or commercial factor VIII concentrates. The amounts of these available at any point in time was variable, with supplies of NHS factor VIII being the least available. Cryoprecipitate is a product that was suitable for use in the haemophilia unit, but not favoured for use at home because many patients, particularly children, can have anaphylactic reactions to this product. Cryoprecipitate was therefore used only for treatment on demand in the haemophilia unit, particularly for newly presented patients, until it was clear whether or not they would require regular treatment, as it was known that infrequently treated or mildly affected haemophiliacs were more at risk of contracting hepatitis B and becoming hepatitis B carriers if treated with factor VIII concentrates rather than cryoprecipitate. Patients of younger age prior to training for home therapy were therefore likely to be treated more frequently with cryoprecipitate. However, if cryoprecipitate of an appropriate ABO blood group, or if the patient had had reactions to cryoprecipitate, or one was treating a major bleed or required a smaller volume product, factor VIII concentrates were more likely to be used. The type of concentrate would be determined by availability, but the unit tried, if possible, to maintain a given patient on either NHS or commercial concentrate. In late 1976, in an attempt to control haemophilia bleeds and to give patients a better quality of life, home therapy programs were introduced. This therefore required increased amounts of factor concentrate, and commercial concentrates were more available than NHS concentrates. And then he says this about his knowledge of risk. I was well aware of the existence of viruses causing serum hepatitis from the time that I came to the Birmingham Children's Hospital, and that was in 1976, he says elsewhere in the statement. I was aware that concentrates made from pooled plasma carried a greater risk of hepatitis than blood products made from single donors, and we closely monitored our patients for jaundice. Tests for screening for hepatitis B were introduced in the UK in the mid-1970s, and these tests were conducted on our patients. I was aware of the AIDS syndrome in homosexuals from 1979-1980. From my dealings with other patients, I became aware of the possibility of AIDS being a condition encountered in haemophiliacs in early 1983, but I had no knowledge of whether the condition was associated with a virus infection or could be associated with imported factor VIII concentrates. I was certainly conscious that there was a similarity between haemophiliacs and homosexuals in that both had an increased risk of hepatitis, but there were many theories about its cause, including that it might be related to an increased antigen load. It was not thought that there was any call for any treatment alteration because of the association between haemophilia and AIDS based on information available in 1983, and to withhold treatment of acute hemorrhages was considered more dangerous. There's then a reference in the next paragraph to a tuberculosis outbreak in the Children's Hospital. I'm not going to read through that. If we go to the bottom of the next page, please. Last paragraph. He says this: the treatment policy that I had in the unit for severe haemophiliacs was to treat newly diagnosed infants initially with cryoprecipitate, and then he refers to what he'd set out above. And then top of the next page, he makes this statement: cryoprecipitate was not appropriate for use at home because it had to be stored under strict temperature conditions in a deep freeze, or it would be dangerous to use, and the risk of anaphylaxis occurring without immediate medical help. These risks outweigh the advantages of cryoprecipitate of reduced donor exposure and making factor VIII concentrate the treatment of choice for children once they were on home treatment. Factor VIII concentrate was also the treatment of choice if a patient had any anaphylactic reaction to cryoprecipitate, or when one wished to be certain of a definite rather than expected rise in factor VIII units. And then paragraph 14 tells us that normally we would consider a patient for home therapy at about 3 years of age, although it was not uncommon for it to be earlier, particularly as our unit was very skillful at training patients and their parents to be able to administer factor VIII at home. He then refers in the next paragraph to on-the-job training for senior house officers and a written instructional protocol, and he refers to attaching that document, and indeed we have that document which we'll look at in a moment. He asserts that the document sets out the fact that cryoprecipitate is the most frequently used material, and that freeze-dried factor VIII is reserved for patients who've had severe anaphylactic reactions to cryoprecipitate that cannot be controlled. And then if we go over the page, he then details Jonathan's treatment and puts forward thoughts about the treatment. If we pick up, I'm not going to read it all, but we can see about 8 lines into this paragraph, 8 or 9 lines, he refers to Jonathan being given factor VIII, the Armour factor VIII, on the 27th of March 1981. And he says this: I cannot decipher the signature of the SHO who treated the plaintiff, and there is no indication on this note as to why factor VIII concentrate was given on this occasion. It could have been that no cryoprecipitate was available, or it was felt more convenient to give factor VIII concentrate, or to ensure a predicted therapeutic response. And then he looks at a number of other occasions upon which Jonathan had been given Armour factor VIII. If we then go over to the bottom of, I think it's page 8, Lawrence, please. He makes this assertion, again going to the generalities of the approach to treatment. The Birmingham Children's Hospital never had sufficient supplies of NHS factor VIII concentrate to meet its needs. The supply position for the hospital in relation to blood products between 1981 and 1985 was, and then he refers to an attached schedule. And then he says this: it was my view at the time that the NHS material was safer because of the lower transmission rate of hepatitis. It was a product I would have preferred for all my patients if I could have received enough. Given the difficulty in supply, I made efforts to ensure that the commercial product which we received limited potential exposure from hepatitis-infected donors to the patients. I attempted to purchase entire batches of concentrate so that the batches could last much longer, and I also aimed for bottles with smaller numbers of units which were better for the size of our patients. And then he refers to setting up a priority system for the use of the very limited supplies of NHS concentrate that he says he had available, and it seems essentially to be if there was an anaphylactic reaction to commercial factor 8. We then have a heading, Advice to Parents of the Risk, and he says this, and obviously be picking this up with Brenda and Linda in due course as well. It was always my practice to keep parents informed of risks as we knew them. As stated earlier in this statement, however, we had no reason to suppose that the treatment being given exposed the patients to an AIDS risk at the relevant time. However, we were aware of the potential risk of the transmission of hepatitis virus by all blood products. This risk had to be set against the risk of leaving the haemophiliac bleeds untreated. And then he refers to aspects of Richard's treatment. And then if we go over the page, the assertion in the second line is the risks of treatment and balancing these risks against not managing the haemophilia bleed by treatment with concentrate was always discussed. Then he refers later to meetings, including, I think, possibly the 1984 meeting that we've already referred to. Could we then go to the next page briefly? I don't propose to read this out, but if we could just turn it round. This is the schedule that Dr. Hill refers to, and it gives the product usage. So I haven't had an opportunity yet to match that up against information in the annual returns, but we'll certainly do that.
The presentation which you provided on the Birmingham Children's Hospital of the two Birmingham hospitals showed that in 1981 the product mainly used for inpatients was mainly NHS product with some factor 8, and home treatment was mainly commercial. 1982, it was mainly factor 8 armour product, some NHS and a little cryoprecipitate. Those who were at home were mainly on factor 8. In 1983, some cryoprecipitate, some more NHS, but mainly factor 8. And in 1984, there was somewhere between 20 and 25% of the total product used was NHS, 70 to 75% was commercial, and about less than 1/16 was cryoprecipitate. In 1985, what you observed at the time, there was never enough NHS factor 8 for all the patients. 1985, the armour supplies were said to be steady. There was some unheated National Health Service product, but the demand for cryoprecipitate then increased. That's what I was told.
Yes, and that was information drawn from the annual returns.
Yes.
And so what we'll need to do, Elizabeth, having very kindly been able to provide us with this document, is to see whether the information Dr. Hill was giving the court matches up with what was in the annual returns. And then just briefly, if we go to the next page, we see the written protocol, which his statement says was a document issued to senior House officers. I'm not going to go through the detail of it, but it may be that in terms of, it's undated, but it may be describing a state of affairs in the 1970s rather than 1980s. And I say that because if we go to the next page, please. Under the heading Dose of Replacement Therapy, paragraph 3 says type of therapeutic material available. A, cryoprecipitate, most frequently used material. B, freeze-dried preparations of factor 8, small amounts only available. And so that certainly isn't the position either described by any of the witnesses we'll hear from today by the time we get beyond the second half of the 1970s, nor is it the position that the annual returns reveal. So although it's an undated protocol, it does look as though it really must be referring to the position in the 1970s.
Yes, Dr. Hill suggests it was the relevant protocol at the time in his statement.
He does, yes.
He may be wrong.
He may
but
be wrong.
That's what he says.
Yes, it is. So our thanks, Elizabeth, to you and to Jonathan for providing us with that information, which is of great assistance, as we didn't have a full statement from Dr. Hill. I'll just ask you a little then about hepatitis C. You didn't recall discussions with Dr. Hill about hepatitis C. You told us in your statement Jonathan asked himself to be tested in around 94, 95 and learnt he was hepatitis C positive. In relation to Edward, at the time you drafted your statement, you couldn't recall being told by Dr. Hill that Edward had tested positive for hepatitis C. But as I understand it, in the course of preparing for your evidence today, you found some material which suggests that you may have been told.
Yes, and this is the difficulties of memories over so many decades, and the fact that HIV was the big worry and hepatitis was always presented as something not to worry about at the moment, I think. But yes, there were letters in Edward's treatment record of certainly letters to the GP that explain that he has discussed hepatitis with me because Edward, let's get the name right, Edward had periods where he was really lethargic and not very well for some weeks, and I was quite concerned about that and talked to Dr. Hill about that. And he had abnormal liver function test results. And so it was likely that it was non-A, non-B. And then we were told before he left the Children's Hospital that he was HCV positive, I think in 1992. Now,
You hadn't told Edward, who'd been profoundly distressed by Richard's death. You hadn't told him that Jonathan was HIV positive.
No.
How did Edward learn of Jonathan's diagnosis?
It was very difficult to know what to say when, but we went to St Thomas's Hospital for treatment following eviction from the Children's Hospital. And it wasn't our first clinic there, it was some months in. I took them to a clinic and a new doctor appeared, and he walked in the room with both sets of notes and he said to me, "Let me get this straight. Jonathan has HIV and Edward has hepatitis C," in front of Edward. I think Jonathan was sitting outside but heard the conversation. And what do you do in that situation? So I confirmed that he was correct. I think he couldn't understand why Jonathan had got HIV and not hepatitis C as well, and yet Edward had hepatitis C. And then after we'd had the consultation, I went out and found the doctor and explained to him that Edward hadn't known before. And he was profoundly sorry. I mean, it was just one of those things. He was thinking hard and not thinking straight, I think. Yeah, but I think it helped us because it breached that difficult decision about when to tell. And Edward was old enough at that time to be able to keep a secret and to have a conversation with.
Jonathan, in terms of his own health, suffered PCP in 1997, pneumocystis pneumonia. You, because not least I think of having lost Richard, you feared that was the end for Jonathan.
Yeah. I know there's a number of people here who've lost more than one child, and I can't imagine how they deal with that. I listened to Sue last week from Alderhay, and my heart went out to her. Because the second time it's happening, it sort of reawakens all of the emotion of the first time. And it was me who needed to go and see him at St Thomas's when he was admitted for PCP. It wasn't him that needed me. But I just had to get a train straight down and be there. And I just kept going for walks along the Thames to cry, because I didn't want to cry in front of Jonathan. But we were very fortunate in that in a couple of weeks he was well enough to come home, and he's still here.
You described in your statement your focus throughout these years was trying to focus on the positive, trying to keep life normal. And you said in your statement, looking back now, you don't think you realise the full extent of the emotional and physical impact on you all.
I don't think we could have coped or had any sort of sensible life if we'd have wallowed is the wrong word, but if we'd have spent too much time thinking about the difficulties. And I've been a very optimistic person all my life, and I think because I had such good support around me, it was always just another challenge to deal with.
But you also observe in your statement you wish there'd been access to professional help.
Absolutely, yeah.
To enable you and your family.
Particularly for Edward, who was just devastated. He wouldn't leave my side after Richard died. He wouldn't go to school. He just wanted to take some toys and play with Richard in his box, his coffin. Because at 4 you don't have a concept of death really, and he was the one who always tried to make Richard feel better. They were similar mental age, I think, and from being a happy-go-lucky little boy who was always sunshine, Edward became morose, difficult, depressed. He started wetting the bed again at night, which distressed him for years afterwards. And I tried very hard to get help for him. In fact, one of the letters from Dr. Hill in the notes talks about me asking for psychiatric help, and he didn't think that was appropriate, and he wrote to the GP and told her and said that he discussed some strategy with me, and he gave me a chart a sort of gold star chart for when Edward was dry at night and things like that to try and encourage him. And I found a friend who was a lay counsellor who said that she would try and talk to him to try and help him, because at 4 you don't have the language to describe how you're feeling. And she spent quite some time with him over a period of months, taking him for walks in the parks and playing games with him and trying to get him to talk. And she said to me, I can't do this. She said, I've been trained to work with adults on a lay basis. She said, and I don't think I'm making any progress. So I went back to the hospital and asked for some help. But there was just none available. And we saw Edward, from being this confident little boy, just fluff nearly all of his exams, his piano exams, as well as school things, because as soon as there was any sort of test, he froze. He just couldn't do it. He wasn't confident. And he took that into his adolescent years, which, were then compounded by treatment for hepatitis C and so on. And I don't think he's now the same person that he would be had he had the help that he needed at that point.
You told us about Richard's post-mortem and the consequences in terms of the media activity and so on. But you've also recently seen a letter in Richard's medical notes. Are you content for us to look at that?
Yes.
It's WITN 1021012. Second page, please. And it says, it's from a neuropathologist, it's May 1987 to Dr. Hill, refers to the Home Office pathologist, Dr. Ackland, and says in relation to Richard, he died last year. Dr. Ackland kindly let me have the brain, as I understand he was HIV positive. I've got sections which are really quite interesting, but difficult to interpret, and I wondered if it's possible to have a look at the notes, as I've only a scanty clinical history. Now, you'd given consent for there to be a limited post-mortem.
We had.
But is it right you did not know that there were organs or tissue elsewhere?
We thought, because the coroner wanted a more extensive post-mortem, and we wanted to support the learning about what this disease was, thinking it was HIV at the time. I don't think we would have objected, but not knowing that his whole brain went somewhere else, particularly to the place where the consultant paediatrician in Wolverhampton wouldn't send Richard when he first had a brain problem, sent him to Alderhay, which is 100 miles away instead, because he hadn't confidence in their capability of neurology in children. It just jumped out at me when I saw it in the notes.
And it's the lack of consent.
It's lack of consent, it's the lack of knowing, and having understood from the Bristol inquiry that the consequences of samples being everywhere. I guess it's no longer there, but I don't know.
Elizabeth, I'm not going to ask you in detail about matters relating to Jonathan and Edward's ongoing health. They are both, I think, going to be able to provide their own statements to the inquiry, and we have a statement from your daughter too, which describes the impact upon the family from her perspective. Just wanted to pick up on a couple of points, though, if I may. The first is, in your statement, you refer to your guilt at giving the boys haemophilia.
I don't think I'm alone in that with carriers of haemophilia. Not that I could do anything about it, but it is, you would never wish something like that on your children, and particularly because I wasn't certain I was a carrier until I'd had the two. I couldn't have prevented it, and Edward I felt very embarrassed about when he was diagnosed with it. But yes, so I felt an added responsibility, I think, to try and make life as good as I could for them despite that.
And then the final point I just wanted to ask about for present purposes was about an issue relating to the Skipton Fund and Richard. You made an application to the Skipton Fund, obviously a number of years after Richard's death, which was turned down.
It was.
Because having died at such a young age and before tests were available for hepatitis C, you couldn't prove that he had been infected with hepatitis C. You then, I think, after you heard some of the evidence given to this inquiry about the Skipton and EIBSS from Nick Fish and from Professor Thomas, you made a further application. Can you just tell us about that?
Yes, I applied in 2011 when it became possible to apply for people who'd deceased, and that was turned down, as you say. And I was so upset when it was turned down. I can remember scrumpling all the paper up and putting it on the fire because it was just like you sort of raise your expectations and then swipe. That's it. And I didn't know what more I could do because the evidence isn't there. And yet it had been presented to me as if they were HCV positive or had been exposed to HCV, then you were eligible for the 20,000. Not that you had to have evidence of chronic illness. So I thought, well, that's it. Didn't pay any more attention to it until I heard the evidence that you mentioned. And then I thought, well, this isn't right. So I got the information again that that's right, I'd applied for the notes, Richard's medical records, and I saw copies of the application in Richard's notes and Dr. Williams' letter to Skipton on my behalf that you had to supply as part of the pack originally. So I thought I would write to Mr. Fish and say, you said this to the infected blood inquiry and this is the application that I made, and please will you reconsider? And I had a letter back from the support scheme saying you need to fill in a new form and you need to send it to the Children's Hospital and they need to write to us again, otherwise we can't consider it, we can't deal with it as an appeal. And so I didn't want to trouble the Children's Hospital again. We were in the middle of COVID and they were far too busy anyway. And there was no new information because I'd had a look at the records by then. So I couldn't see any point in reapplying. So it sort of sits like that, really, in that I'm no further forward. They won't consider it until there's further evidence. There is no further evidence to have. And yet Richard, through his life, just at Birmingham Children's Hospital, so this isn't around the brain operations, had, I reckon, from my best translation of the medical notes, at least 104 units of blood in his life through the period where hepatitis C was being acquired through blood transfusions, not blood products, as well as all of this commercial factor VIII. From the evidence that you mentioned, it's 100% likely would have had HCV. And I feel guilty again because I'm not desperately poor and I don't need the 20,000 to be able to get by next week. But it's just this, it's a sense of injustice. You know, if they were clear about that, and I only found out about the ability to apply because other mothers had said, or they'd all applied, and I didn't know about it until I heard from them. So I actually applied late in the first place. It was just really poorly managed.
And to the others follow, the evidence that you referred to from Mr. Fish and from Professor Thomas was evidence to the effect that the approach taken by Skipton was if you were a haemophiliac who had been treated for with factor concentrates, certainly for any prolonged period of time, they worked on the assumption that you would have you would have been infected with hepatitis C. And yet Richard, having been treated with very significant quantities as well as the blood transfusions during his short life, they have rejected the application. Thank you, Elizabeth. I'm going to turn next to Brenda and ask Brenda to tell us about Andrew. So Andrew was born in 1972, is that right?
That's right, yes.
Diagnosed with severe haemophilia A from birth?
Not from birth, from around 6 months old. I've got haemophilia in my family. My grandfather was a haemophiliac, my brother, 2 cousins. So I knew the likelihood of me being a carrier, although it's never been confirmed, because I don't think in those days there were any tests to tell you whether you were a carrier or not. So when Andrew became 6 months and he started to move around a bit more, rolling on the floor and things like that, I wanted to know. So I went to a family doctor and he sent us to the Children's Hospital to have some blood tests taken. Because my theory was, if he is a haemophiliac, I want him to have records. So if he needs treatment, there's going to be no delay. He can have the treatment. So that was when we found out. He was 6 to 7 months old.
And he was under the care of Birmingham Children's Hospital, and Dr. Frank Hill was the consultant.
Yes, yes.
Now, to start with, in the 1970s, Andrew was treated with cryoprecipitate.
He was, yes, he had the cryo when he was a baby for so long. But I'm not sure whether that was before the factor VIII was so readily available. Because I do remember the factor VIII becoming a thing, and we all thought, oh, this is wonderful, you know, breakthrough treatment. We were all going to be able to live a more normal life. But mainly, I remember Andrew having factor VIII rather than the cryo. So I don't think he had the cryo for that long before he was changed onto the factor VIII. And in the beginning, he was given the NHS factor VIII for quite a while, I believe. And then the one day we went for treatment and he was given this armour factor VIII. I remember the doctor on duty, I think it was an out-of-hours doctor, because we'd be there day or night, any time really. And the doctor said, this is something new, this factor VIII is new, and some of the boys have had a reaction to it. And if he gets a slight reaction, don't worry, it's nothing to worry about. So that sort of sticks in our mind, that was when changed over. And I think after that, I think he was mainly given the armour factor VIII. But I mean, I can't say for sure about that. But when it comes to batch numbers, I don't think they ever seem to take any care about giving the same batch numbers. You were just given what was in the fridge, weren't you, really, as far as I could could remember. Don't remember them trying to keep them on the same batch numbers.
And what, if anything, were you told by Dr. Hill or anyone else at the hospital about the risks of hepatitis from
I
concentrates?
don't remember hepatitis being mentioned at all, to be quite honest, when Andrew was a small child. I honestly don't remember that being mentioned. I was quite shocked to hear that they knew about it back then. That, to me, was something that came into our lives after the HIV, quite a few years after.
And what, if anything, were you told about the risks of transmission leading to AIDS?
Nothing, really, that I can remember. When it all started to blow up, there were 2 meetings that Dr. Hill called at the hospital. We could only attend one because we were on holiday for the second one. I think it was in the autumn, but we always used to go away in the October half term. And I think the second one was then. So we went to the first meeting, which I remember Dr. Hill stressing that it's in the boy's best interest to carry on with the treatment. And in those days, we all, we believed doctors, we put our faith in doctors. We've got a child with an ongoing condition. We followed what the doctors said. So, we blindly carried on giving the treatment. But I do wonder afterwards, why couldn't they just temporarily stop the factor VIII treatment while they investigated exactly what was going on and give us some more information? Why did we have to sort of blindly carry on? And I mean, Elizabeth was talking about the guilt as well. There's also the guilt of having home treatment and me giving Andrew the factor VIII at home. Did I actually administer the dose that infected him? It's quite possible. So as well as the guilt of being the carrier that gave him haemophilia in the first place, there's the guilt of I could have been the one that actually administered the dose.
And at the meeting that you did attend, possibly in the autumn of 1984, but whenever it was a meeting, was it, that involved other parents?
Yes, just a general meeting that parents were invited to. And there was quite a few went, because obviously everyone was concerned about things we'd been hearing about what was happening and what could be happening with the AIDS virus. So it was well attended.
And in your, sorry.
No, carry on.
In your statement, you say this about the meeting. We were told categorically by Dr. Hill that the boys would be better off continuing to take the factor VIII treatment and that the hospital would not be stopping anyone's treatment.
Yes, that's right, yes.
And do you feel that in relation to the treatment that Andrew had received over the years, do you feel that you were ever given a choice of what treatment you would have?
No, I don't believe we did ever have a choice. Of course, we were all just also grateful to have treatment. We wanted a better life for our boys, didn't we? And the factor VIII was giving our boys a better life.
How did you find out that Andrew had been infected with HIV?
Well, it's really difficult. I don't think we were at the meeting where Dr. Hill, where Elizabeth refers to Dr. Hill as saying, if you want to know, make an appointment, come and see me. I don't remember that, so that was probably the meeting we couldn't attend. When Andrew was around about 12, 13, when we took him to the clinic at Children's Hospital, Dr. Hill suddenly started saying, the boys are getting older now, we need to prepare them for moving on to the Queen Elizabeth Hospital. We'll see the boys alone in the clinic. You wait in the waiting room. I thought this is a bit strange, but I thought, oh, okay, obviously the doctor knows better. So Andrew started going in to see Dr. Hill himself. And all of a sudden, Andrew's behaviour changed. And he started becoming really sort of depressed, and his behaviour changed completely, and he started losing interest in school. I think it was in his probably second year at secondary school. And we couldn't understand why this change in him. But it turned out that Dr. Hill had told him his HIV status at one of these meetings, that we weren't there, one of the clinic, the clinic meetings, that we weren't there. And Andrew didn't tell us what he'd been told for quite a while. So we didn't know. But I found out because when Andrew was an inpatient, I can't remember exactly how long after, he was an inpatient in hospital, probably overnight, a couple of nights, I think it was dental. Sitting by the bed, you just look through the notes, to see what's going on. And there it was written on the top of the page, HIV positive. And that was the first official thing that I'd seen or, been told about it.
So you learnt that your child had been infected with HIV accidentally,
Yes,
because
yes.
you were looking through the notes.
Yes, yes.
When you learnt that Andrew had been told by Dr. Hill that he was HIV positive without you knowing, and without you being there, what did you think of that?
Well, quite honestly, I was disgusted, to be quite honest, because Andrew, he became very, very depressed. He lost interest in everything. And when he started secondary school, first parents' evening, we were told that he was a very intelligent boy, great academic future. He could do really well. And then all of a sudden, he could see no point in working hard at school because he thought he was going to die. He wasn't going to have a future. So what's the point in me working hard? And he stopped going to school. I didn't even realise he wasn't going to school. He was being taken to school, apparently coming out of school and hanging around the streets in the daytime, which we didn't know about for so long.
And I think it must follow from what you've told us that you didn't know that he was being tested for HIV. And
No.
you didn't consent to him being tested for HIV.
Well, they were always taking blood for various reasons. When we went for treatment, they were always taking blood samples. So, obviously Elizabeth said they probably had blood stored, which apparently they did. And I think they were they had blood from the whole family because they were looking at the connections of like the family relationships, and I'm not sure exactly what it was for, but I wasn't surprised that they'd got blood samples because, as I say, they were always taking it for one purpose or another.
And I think it must also follow from your evidence that there was a period of time when the hospital knew that Andrew was HIV positive. You didn't.
No.
Were you still involved in his home treatment?
Oh, yes, yes.
So you have a son who's a haemophiliac, you're administering treatment, you're at risk yourself, and you didn't know that?
No. Well, when we started on home treatment, they automatically give you some plastic gloves to handle the factor VIII. And I mean, I was always under the impression that that was to protect Andrew from germs from me, really. Because, you're punching in their skin, you don't want to pass anything on to them. I never even dreamt that it would work the other way around.
You touched on the impact on Andrew, now in his early teens, from what you described, withdrawn, stopping trying at school and so on. In terms of hepatitis C, how did that diagnosis come about?
Well, by the time we knew about the hepatitis C, Andrew had moved on to the Queen Elizabeth Hospital, so he was no longer under the care of the Children's Hospital. And life was quite difficult because it was a time that all the stories were in EastEnders and one thing and another about AIDS and the news, the information on the television and everything. So Andrew found that quite difficult to cope with. And then because he was at the Queen Elizabeth, he was considered an adult now. So as parents, we weren't involved at all, really. And one morning, a letter came for Andrew from the Queen Elizabeth, and I passed it over to him, thinking it was an appointment or something. And it was a letter stating that he was positive for hepatitis. I mean, that just came off like a time bomb, really. Just when he exploded, we just couldn't believe that someone would just be told like that in a letter without any face-to-face.
And you went to the appointment because Andrew now could no longer face going to the hospital.
No, he became very withdrawn. He didn't want to mix with people, and he did start, for a time, refuse to go to the hospital. And he had an appointment with some liver specialists at the hospital, and he just wouldn't go. So I went to this appointment because I wanted them to know what was happening, that he just wasn't just not turning up, that just what had happened to him. I mean, they were very nice and they listened to me, but obviously they didn't divulge any medical information or anything. But I just felt it was something that I had to do so that they knew exactly, or tried to tell them exactly what was happening.
So I'm conscious of the time. I'm very happy to continue, but I know the stenographers require breaks from time to time. So I'm in your hands.
Well, I think I'm going to ask the stenographers to bear with this evidence. It's not being given at a very fast speed. So we'll go on till the usual time for breaking, I think. But let me just say that if the stenographers take a different view, they should indicate through the usual channels.
You told us in your statement that there was a complete change in Andrew. He went from your sociable, funny boy to someone who was withdrawn and depressed.
Yes.
He didn't want to get close to people.
No.
He would have mood swings.
Mm-hmm.
He became paranoid.
Mm-hmm.
And you and your family felt as though you were walking on eggshells. You didn't know what might set him off.
Yes, that's right.
And of course, you had your daughter,
Yes.
who was also affected by this.
Well, we tried to protect Michelle as much as we could because she was 8 years younger than Andrew. And I didn't want this tragedy to affect two children's lives. So we encouraged her to do normal things. And to be perfectly honest, we didn't tell her about Andrew's HIV status or the hepatitis. But obviously she must have picked up that something was going on because it was not sort of a normal behaviour in a household. But we did try to keep her, protected as much as we could. But with Andrew, he wouldn't even tell anyone he was a haemophiliac because he didn't want it associated with the HIV. And he thought if anyone knew he was a haemophiliac, they would automatically think he was affected and the stigma that was attached to it. So he just would not make any firm friendships. He'd got lots of sort of friends, but they weren't close friends because he was frightened of everyone sort of finding out, and he wouldn't let us tell any of our friends. So we had no support. We had to pretend everything was all right with our friends, and put on a happy smile. My mother knew because she is the daughter of a haemophiliac, and she was a great support to me. But my husband's family didn't know all the full facts, again because Andrew didn't want them to know. So we were living in like this isolated world with this volatile, well, he was a child, but he was a teenager. He was a big teenager who we didn't know who we were going to get when he came in the door, how he would be, when he got up in the morning, we didn't know how he would be. I mean, sometimes he would get so pent up and frustrated that he'd punch the doors and punch the wall, put his fist through plasterboard and door panels, just out of sheer frustration of the situation that he was in. And towards his latter years, he was an inpatient in the QE, and he became really agitated in the ward, and he had a drip into his arm, and he was just so agitated, and his mental state was terrible, and he pulled the drip down, but he'd left, the needle was in his arm, and it was hanging out, and he just got up and marched out of the ward. He just, I'm going, I've got to get out of it, I'm going. He marched out of the hospital, and the security people were following him, and I was following them. We were all following him down the road, trying to keep him safe. And he went down to the bottom of the road, and he was walking up and down. Eventually, managed to get him back into the hospital, but they couldn't calm him down at all. He was just totally distressed and disturbed, that he was taken from the ward to the psychiatric unit of the Queen Elizabeth Hospital, where he was forcibly kept overnight for his own safety, I think, to just sort of try and calm him down. And the next morning I had to go, and they did let me calm down, and they did let me bring him home.
And you told us in your statement that from around the late teens, his physical health started to deteriorate.
Yes.
He became very fatigued.
Yes.
He would experience hallucinations.
Yes, he did have hallucinations. We'd be in the car, he'd be sitting in the back of the car. Suddenly he'd be, oh, what's that? He was sort of seeing things. I think it was all to do with his liver. Just totally unpredictable, really, of what, it was just really difficult. He also started having really bad nosebleeds as well towards the end. And I mean really bad nosebleeds.
And there came a point when he was under the care of the Queen Elizabeth Hospital, and you were called to the hospital and you were told he was terminally ill.
We weren't actually told he was terminally ill by the hospital. That was a bit weird. We had a meeting at the QE where our GP was invited to, and everyone else in his care, myself and my husband and our GP. And it was our GP that referred to him as being terminally ill. And that was the first time we'd heard it, put into those words. And I just thought that was a bit strange, really.
And then you weren't actually able to see Andrew the day that he died because you tell us in your statement you're concerned you weren't given the most accurate and up-to-date information by the hospital, so you weren't able to get there to be with him.
I wasn't with him at the end because I didn't realise how things actually were. I mean, I rang up on the morning and I was just told, he's had a comfortable night. And so I said, oh, right, I'll be coming up. And I went and picked my mother up. If I'd have known it was so close to the end, I would have just gone straight there. And I went and picked my mother up, and she came with me. And when we got to the hospital, we were too late. But I didn't realise from what they'd told me that I was actually going, it was going to be so close to the end.
And how old was Andrew when he died?
24.
He didn't, as I understand it from your statement, receive treatment for HIV or HCV?
No. I think it was a little bit before the antivirals became, in use. So there was no treatment.
And did he ever receive any counselling, psychological support?
No.
And what about you and the rest of the family?
No. I did ask my GP a while after Andrew died that I felt I could do with some counselling, but he just sort of, time's gone by now and it's not really appropriate, and there was nothing.
What can you tell us about the longer-term impact on you, as Andrew's mum, of what happened?
Well, you never get over what we've been through. And I think, we could all probably say we're a different person to what we would have been. I think I've sort of lived my life since Andrew died, that I've sort of compartmentalised it, and I've just got on with things, because I was always frightened that if I thought about it too much, the floodgates would open, and I've never shut them. So you try to just carry on. I mean, I had a 15-year-old daughter, wanted her life. I wanted her to enjoy a life and live a life and not be, have her life spoiled. So we concentrated on her. But it has all been bottled up inside. But I just didn't know what else to do.
And we've got some photos of Andrew. Is it okay if we look at those?
Yes.
Lawrence, could we have those photos, please? You can just tell us about them. So what's this one?
That's us when it was happy, a Boxing Day at Nan's. Andrew, smiling, Michelle. There's 8 years difference between them. But that was before everything, everything, life was great, everyone was happy. A nice little happy family. And that again is holiday. We were on holiday. Happy. Michelle, a toddler. Andrew, 9 years old, enjoying himself, and just living a lovely life. That was Andrew, his first year at secondary school, again just before everything started to blow up. In his school uniform, all proud, and, the whole future in front of him. Now that's later on, when Andrew had started to become ill. I think if you look at his face, you can see that he is, he's quite ill there. And that was the day when we'd gone down to visit Grandad, who was staying in a caravan, so we went for the day. And it was on the way back from there that he started having hallucinations in the car as we were driving home, which were really quite frightening. And as you can see, he was quite a big chap, and could be quite sort of frightening, when he started having these episodes. But so I don't really like to look at that photograph, because to me he just looks so ill on there and not like himself.
Thank you. So we now have the evidence from Linda. What would you wish to do?
Well, let me ask Linda. We can take a break now and come back at 1:45, if you'd like, and then hear your evidence then. Or you can start now if you want.
I don't mind carrying on. I was just getting a bit upset listening to you, sorry.
Well, I wondered.
But I'd rather carry on, I think.
Okay, well, we will be taking a break in the middle. That's the only thing. Are you happy about that?
I'm taking a break.
In the middle of your evidence.
Right.
So you might prefer to have it all in one go.
I'd rather do it all in one.
Well, if you'd rather do it all in one go, we'll take a break now.
I'd rather just carry on. Get it over with.
Yes, well, I think
If I can.
that would eat into everyone's lunch hour.
I'm told the stenographers need a break, I'm afraid.
All right, well, that determines it then. May I thank the stenographers for going on to make sure that they captured all of Brenda's evidence. So we'll start at 1:45.
Okay.
And then you have a free run through right till you finish.
And just to say, I'll be inviting, obviously, Elizabeth and Brenda to come to return and sit with Linda, and once we've heard from Linda, I'll just want to pick up some general issues about the Birmingham Children's Hospital with all three of you.
Yes, I was going to say that there are general themes which Ms Richards is likely to pick up and take the views of the three of you. It's one of the great advantages of having three people who have such similar experiences, although there will be slight differences between them. So 1:45.
Earlier.
I
She's nice, isn't she?
Linda, can you hear me okay?
Yes.
I'm going to ask you to tell us about your son, Michael, and his treatment at the Birmingham Children's Hospital. So Michael was born in 1969, is that right?
Yes, that's right.
And he was diagnosed with severe haemophilia A when he was about 3 years old?
No, 2.
2.
About 2. Yeah.
What can you tell us about that?
Well, you know when they start to crawl when they're little and everything, he was getting these bad bruises with lumps and things. Well, our GP, who I took him to see, he'd been a family doctor, and we've never known haemophilia in our family. So, you know, that isn't what he didn't suspect that. And he used to give him vitamin C and things like that. And he even asked me if I was knocking him about. He says, I've got to ask you this. And I said, well, good Lord, no. And anyway, he retired. And Michael would be about 2. We had a new doctor, a young doctor. And we went through it. He had a swollen knee, I think it was. And I took him to the doctors. And he said, well, he just looked back at the records and he asked me questions. And he said, I want to send you straight up to the hospital. And he wrote a letter. And he said, I want you to take this to the hospital in Wolverhampton. So that's what I did. And I was just amazed because they said, we've got to keep him in. And he was just taken away and I had to go home. And it was like that in those days. They didn't let you hang about, you know. So I went home and I did nothing but weep, you know. I didn't know what was going on. Anyway, when I had to go back, they took me to one side and they said that he's got haemophilia. And I've got to be honest, I'd never heard of it before. So I'd done. We found out that he was haemophilia. He'd got haemophilia, and then I had him transferred from Wolverhampton to the Birmingham Children's, to the haemophilia department, and then we just had to keep going up every time he hurt himself in some way. We would have to go up the hospital. And when they're little, they're always falling or doing something, aren't they? So it was quite a journey every time, you know, but had to be done.
And initially, Michael was treated with cryoprecipitate.
Yes.
And then, I think at a time when he had NHS concentrate.
Yes, that's right.
But then, and your recollection was that it was perhaps the early 1980s, we can look at a document in a moment, but it was switched to US commercial concentrates,
yeah.
and it was the Armour concentrate, I think, that you mainly remembered.
Right, okay. I know it was I can't remember the name. Now you've said it, I recognise it, but...
Were you told anything, whether by Dr. Hill or anyone else at the Children's Hospital, about the risks associated with the factor concentrates?
With the American, no. Well, I went to the meeting that you mentioned earlier. To me, when they were on about this virus, I hadn't really heard of that before. So it was like, you know, taking it all in and knowing what was going on, really. And I knew it was a worry. They was talking as though they'd only just sort of found out. That's the way I felt at the time.
Before we get to that meeting, though, which was probably 1984, your son had been being treated during the 1970s and the early 1980s. So before that meeting, did anyone ever tell you that the concentrates might transmit hepatitis?
No, I was told by Sister Mary, and that they would be stopping the British one because it was a lack of supply. So she said, we're having it from America. And that's all she said. So you just accept that that's it, you see. So he was put on that treatment. And I can't remember how long it was from then to when we had the meeting.
We can look at a document which you've exhibited to your witness statement, and it was a document filled in, I think, at the time of the haemophilia litigation, and it's been filled in by a doctor by reference to Michael's records. So if we look at WITN 1616003, and if we go to the next page, it's described as preliminary medico-legal report on Michael Anthony Price. And then if we go to, we can see it refers to documents, letter of instruction, and then records from the hospitals, uncertified copies of batch numbers from the Children's Hospital. And then if we go down towards the bottom of the page, we can see there that the doctor who's filled this in had Michael's records. And then we can see the words haemophilia A severe, diagnosed at 3 years old, cryoprecipitate 1973 to 1997.
Yeah.
And then if we go to the next page, and we look at the bottom of the page, the very bottom, we've got there the date the client was first given factor VIII or 9 concentrate, 23rd of May 1977. And then if we go over the page, we can see it says under the paragraph B at the top, Armour 1977 to 83 and 1986, NHS 1978 to 86, including Scottish 1984, and then Alpha, which is a different commercial product, 1986 to 1987. Yeah. So it looks from this as though Michael was treated as sometimes with an NHS product, but certainly also with the Armour product. And that's what you remember from the conversation with Sister Marion, that they were going to have to switch to that because they didn't have enough NHS.
Yeah, and that's all I was told, yeah.
And do you feel you were ever given a choice about what treatment Michael would receive?
Not at that point, no. She just said that's what was happening. So I just accepted it, you know.
And Michael, according to this document, was on home treatment from about 1977. Do you recall that?
Yes, yeah.
Prior to that, when he'd received cryoprecipitate in the hospital, had he had any difficulties with the cryoprecipitate?
No, none.
We can take that down, thank you. Can you then tell us what you remember about a meeting at the Birmingham Children's Hospital in 1984?
Yes, I can't remember too many details because it was such a lot to take in all evening, but they were just telling us that about this virus, which I'd never heard of before, I've got to be honest. They were showing you things on boards, you know, like diagrams and things of this virus and you know, and it was a lot to take in. But I knew it sounded bad, but I didn't know exactly. I mean, it wasn't in the news either then. It came on the news after about it. It built up on, you know, the AIDS and that, and then it sinks in how really bad it is, but...
And if we look at your statement, I'll just read out what you say about it in your statement, Linda. So you say, I believe in or around 1984, a special meeting was held at the BCH. I attended this meeting without Michael, taking my sister with me. I recall it was Dr. Hill who ran the meeting in a big hall that was full of a mixture of doctors and parents of children who were being treated at the BCH. Dr. Hill delivered a presentation detailing information about HIV. He went into depth saying the outbreak was caused because the blood had been obtained from Americans who were on drugs or were otherwise diseased. It was never explained why this was allowed to happen. The meeting was directed at letting the parents and patients know that some people may be at risk of infection. They said if you want to know whether your child was infected, to ask.
Yeah.
This was the first time I'd ever heard of HIV or AIDS, so it was very worrying. They told us to look out for certain symptoms. So does that remain your memory of that meeting?
Yes, yeah.
Now, you told us in your statement that you recognised some of the symptoms or thought you did. What can you tell us?
Well, they did mention to watch out if they came down with any illnesses, and Michael had glandular fever, and it worried me after, because they did mention that at the meeting, something about glandular fever. So on our next visit to the Children's Hospital, we had to go and see Sister Marion, and so I asked her then if Michael was all right, because it was worrying me, and she said, don't worry about Michael, he's fine. So after that, we just took it he was fine. And if I can go on,
Yes,
a year
please.
and a half, that's a rough guess. I think he was about 15 or something then. About a year and a half later, probably when he was in his late 16, we was given the bombshell that he was infected. And yet I thought, seeing he was all right then, going back, how come he was given it after that? Why wasn't they careful? Because if they say he's all right, then they should try and keep him all right. And yet he wasn't. And for a year and a half, we just thought it was fine, he was all right.
And you told us in your statement that this occasion when you were told the bombshell came about, you got a letter from Dr. Hill.
Yeah.
And you understood it was about Michael transferring to the adult haemophilia centre.
Yes.
And so you went to the meeting thinking that it was about that.
Yeah.
And at the end of the meeting, Dr. Hill, as you say in your statement, dropped the bombshell that Michael had HIV.
Yes. And there was only me and Michael in the room. My husband waited in the car because he thought it was just to do with moving hospitals, see. And, well, it was, we both went silent. I wish now.
Been told that Michael was being tested for HIV.
No. Well, I hadn't been told, but I suppose they must check them, but I don't know, it's complicated really, because I just thought he'd been obviously being tested to be told that he was all right. Don't worry about him, he's fine. So you just carry on then thinking he's all right. And for that whole year and a half, we just thought everything was fine. And yet they obviously were still giving him the treatment with the infected blood, you know, the infected treatment.
And if we go back to that medico-legal report we looked at a few moments ago, so WITN 1616003. And if we go to page 5, and I'm looking at this because we don't have Michael's records, but we have this report that you've exhibited to your statement that was based on Michael's records. And then the question at the top of the page is about on the date on which the first blood test carried out that produced an HIV positive result. And the answer's given, first sample 1984 retrospectively tested, but report date not given. First fully dated result, 21st of February 1986, sampled. So I think that's the date the sample's taken, and then the report comes back 13th of March 86. Seroconversion occurred in or before 1984. And then question 10, on what date do the records show that the client was notified of his HIV positive condition? 24th of October 1986. So first of all, Linda, that reference there to October 1986, that's consistent with your recollection of it being a year and a half or more after that meeting at which you were told.
Right.
But this document suggests that testing at some point was carried out on a sample of Michael's blood from 1984, suggesting that he and that the result was positive as at 1984. Was that something you were ever told at the time?
No, I wasn't told.
We can take that down, thank you. When you were given this bombshell news, and in the weeks and months that followed, did you receive any support or advice from the hospital?
No. No, not concerning that, no.
Were you just
Well, we moved to a different hospital then.
So you moved to the Queen
When he
Elizabeth?
dropped the bombshell, I never saw him again. We went to the Queen Elizabeth, and we was under, we was under Dr. Wilde for quite a while.
You say in your statement, reflecting on the way in which you were told about Michael's diagnosis, in the way in which you've described, that you felt and still feel as though you'd been lied to.
Well, I do, yeah. Well, for some time I thought, well, I was told he was all right. Was that a fib? I don't know. If it was, well, that was wrong, obviously. And then if it was the truth, then why did they carry on giving it him? And that was what's going in my mind all the while.
Michael was also infected with hepatitis C.
Yes.
But you learnt about that rather later. How did that come about?
Well, it was just after Michael had passed away, I had to go back to the children, back to the QE for some reason. I can't remember now, but I was on the car park just walking across, and one of the doctors that knew Michael, a lady doctor, I don't know her name, she saw me and come over to give her condolences and that, you know. And in the conversation, she just said, well, of course, he was hepatitis C positive as well. Well, I never knew. If I hadn't have met her on that car park, I wouldn't have known.
Can you tell us how Michael's health deteriorated as he got older?
Well, he used to have fatigue, lack of energy. He used to get bouts of diarrhea a lot, and occasional sickness. And he always used to say he ached as though he got the flu all the while, that sort of feeling all the while. And he gradually started to lose weight, you know, and wasn't eating like he used to. As he got nearer to when he was really, really poorly, he used to keep being sick. Diarrhea was bad. He just felt really ill all over. But he did have a lot of things before that. Certain things cropped up. He had pancreatitis, which I just presumed it was to do with the HIV. But thinking about it after, it could have been connected to the hepatitis C. But I didn't know he got it then, did I? So I just assumed it was to do with the HIV. And he had a bout of terrible headaches for oh, well over a year. They were so bad, he was on morphine tablets every day, quite high, to take these pains away. And then the one day, his head just swelled. It was twice the size of what it should have been. And he had to stay in hospital. And I think that they thought that he wasn't going to last very long, but he did get over that, actually. I don't know how, but he did. And that gradually went down. He had psoriasis in his scalp, you know, that's through stress and worry, you know. So he had a lot of things, really. The headaches, and then he did get meningitis at the end, passed with meningitis.
And what had been the effect on him, as a teenage boy, 16 years old, learning that he had this diagnosis? How did that impact upon him mentally?
Well, at first, you can tell it just knocked him for six, really, and that's when he had the psoriasis, not long after that. He went very quiet, and he never really told me exactly how he felt. He sort of kept it in, you know, but he said he didn't want anybody in the family to know at first, and he said he definitely didn't want his nan to know. They were very close, and she was she's nearly in her 80s, you know. So anyway, we did tell the close family in the end, and but he never told any friends, and that's the way he wanted to keep it. But the family were very good, and they kept it into the family, you know. But as time went on, he did seem to cope in his own way, and I'm very proud of him in that way, for how he coped.
Was he able to work?
He did have one job. He didn't really want to do it. He couldn't see the point. But he did go. He worked for in the council offices at Codsall. I think he only worked, I can't remember how long he was there. It could have been a year, I can't remember now. But then he left, and he got no interest. I mean, his ambition was to be a sports photographer because he loved taking photographs. And he couldn't play sport himself, but he loved his football. And he says, I'd love to have been a sports photographer. And he took some lovely photos. And of course, in those days, it was a proper camera with a film in, you see. And he did take nice, lovely photos of animals and things. But that was what he would have liked to have done. But I think in his mind, he thought, what's the point, you know?
And did he receive any treatment?
Sorry?
Did he receive treatment for HIV?
Yes, AZT.
And how was that?
Well, I don't know. He was really well when they... you see, I didn't go in the room with him that day. He went to see Dr. Hill, I think it was, yeah. He went in on his own, and he looked really well. He'd been on holiday, and he looked really well, and he hadn't lost any weight or nothing. And when he come out, he said, a blood test has showed that I need to go on treatment. There was some alteration in his blood, and I need to go on treatment. I've got to start on this tablet. Well, it was AZT, and that's all Michael told me. He'd got to go on this tablet, and he was on it for quite some time. But then he seemed to go downhill, you know.
You described in your statement the last few weeks of Michael's life. He'd come back to live with you, I think, and you were looking after him.
Yes.
And then he had to go into hospital. You've told us about that in your statement. Is there anything you'd like to tell us about it? It's entirely a matter for you as to whether you want to talk about it.
Well, He was living with his girlfriend. She knew all about everything, but I don't know, there was something that she just, the one day, she just told the social worker, and the social worker spoke to me, and she said that she didn't want to stay with him anymore, and she just, I was there, but I didn't know till she said, the girlfriend said, I've got to go to town, and she went out and left me alone with, Michael was in bed, and the social worker told me then that she didn't want to stay with him anymore, and I never saw her again after that, and we had to go and tell Michael, and he was really poorly in bed, and he got upset and started to cry. Anyway, we got him home. We had to get him home before she came back. So we got him home, and then I looked after him. That's when he went really downhill, you know. And I never saw her again, except for Michael asked me to go and get some money out. I don't think this is in his statement, but in the statement. But he said, "Mum, will you go to the bank and get me some money out?" And he gave me his card, and when I went, the account was empty. But that was the ones he used to pay his bills on, not one that he kept his main money in. And it was empty, and I come back and I said, there's nothing there. And he had to phone the bank. Well, he was friends with the bank. It was Midshire's Building Society, and he was good friends with the manageress. And anyway, she said the money was drawn out, so that upset him. Anyway, we went and got the card back off her, and so he was with me then, and he just come and give me a hug, and he says, "Mum, I'm glad to be back home with you." And I said, "Oh, well, I'm glad to have you back."
And then in the last month of Michael's life, he was in the Heartlands Hospital, and you remained there with him.
For a whole month, yeah. Yeah, I slept in the chair at the side of his bed. He'd got his own room and bathroom, you know. And I looked after him and washed his hair, combed. He was mad on his hair being just right, you know. I just looked after him, yeah.
Michael died 1995, just before his 26th birthday.
Yeah.
You'd had to give up work, I think, yourself to look after him.
Yeah.
And after Michael died, your husband had to take a year's unpaid leave to look after you.
Yeah, his boss suggested it. He said, because Paul was worried about leaving me on my own, you know.
Michael was your only child.
Yeah.
And you said in your statement you feel you've lost the chance to have grandchildren.
That's it. He said, that's what he said to me, yeah. He said, "You'll never be a grandmother." And I said, I just said, "Oh, don't worry about it." I didn't know what to say to him, you know.
At any point, did you or your husband or Michael ever get offered counselling or psychological support?
He used to have a social worker that her name was Jill, and they were very, very close, and she helped him a lot. But she used to help him with different things, but I didn't really get too involved with that. I think all that happened before he came back to me, see, so I wasn't there when she came. But she kept in touch. When she left, she went on a world cruise, and she always sent him postcards of where she was stopping, you know. And she kept in touch with him.
And were you offered any kind of support by anybody?
No.
You said in your statement that you still think about Michael every day.
I do, yeah, every single day, yeah.
And you describe it in your statement as a black cloud.
Pardon?
You describe it in your statement as being a black cloud that's lived over you since that time.
Well, your life changes and nothing's the same anymore. And you can't just, I don't know, they're just there all the while. Well, not all the while, obviously. There's times when you're doing things and they're not there, but every day I do think of him, yeah.
We've got some photos. We'll just look at those. Is that all right?
Yeah.
Okay. So if we could have Linda's photos, please, Lawrence. How old was he here? How old was he here, do you think?
Sure. I think he was probably about 7 or something, I'm not sure. Because I never wrote it down. You don't think of these things sometimes.
Where was this?
That was on the beach at Borth, just outside Borth. And he loved the sunshine. And he hated the rain. And yet, just before he passed away, it was raining. And he said to me, he said, would you help me? Outside his room, there was a corridor with glass windows, you could see outside. And he said, would you take me to see the rain? And this is what upsets me, because he knew he wasn't going to see it again. Sorry.
That's all right. Don't worry. Lawrence, are you okay? We've put up a picture that it shows Michael when he's thinner, losing weight, and I think he lost more weight still after this. You don't like looking at it, but you think it's important that people see the reality.
I bought that so people could see, yeah.
And then there's just a couple more photos of Michael as a young adult, which you exhibited to your statement. So it's 1616002, please, Lawrence. So we see a picture of him there, and then there's one other photo, I think, next page. And another there.
Yeah. So you can see the difference with where he'd lost weight.
Thank you, Linda. I'm just going to ask the three of you now just to reflect on a couple of themes emerging from the evidence that you've all given to us today. The first is the issue of trust, trusting in the doctors and assuming that if the treatment's being given, it's safe and it's the right treatment. I think that emerged in particular in your evidence, Brenda, but from what all three of you have said, is that right? You start with you, Linda. You trusted the doctors.
Well, you do, don't you? Your life's in their hands, aren't they, sort of thing, and you believe what they say, and you've got to trust in them. You've got no choice. And then it makes you think after, should you trust doctors? It's...
I, like Linda, took my eldest Richard from Wolverhampton, where he was referred back to from Liverpool to Birmingham because it was the regional centre. Yeah. And I thought it was the place where he would receive the most expert care. And in those days, we didn't expect to be asked consent for everything because that wasn't the custom and practice at the time. So it felt like it was auto-consenting. But it was a relationship of trust, and they had to trust us to do the right thing with the product, particularly on home treatment. But absolute trust was given with them without the most precious things we had in the world.
Brenda?
Yes, we did trust the doctors. I think we'd got a child with an ongoing condition. We put our faith in the doctors to do the best for our children, and we believed what they said. And we followed what they advised without question. And looking back, maybe we should have questioned more. But you didn't in those days. I think maybe people do more now. But in those days, I don't think people did question as much as they do.
And then the second theme I wanted to just briefly ask you about then is the issue of choice. From the evidence all three of you have given, it doesn't appear as though any of you were really given a choice of treatment for your children. No. You would take your child to the hospital and the treatment would be given.
Yes.
You didn't get told what the different risk factors were and you weren't given a choice.
No, there's no choice.
Nothing like that at all.
I remember with the factor 8, we went up and it was what was available in the fridge on that day. That's what it seemed to be.
Yeah, and I think sometimes the professionals didn't have as much choice as they wanted either, because there was a constraint about the supply. And I can remember some conversations, I think it was probably around 1984, where NHS factor 8 was so much in demand everywhere that there wasn't enough for the children who might have been at the top of Dr. Hill's list to be only given factor 8 rather than commercial concentrates. But he didn't have enough to do that, so it was a sort of diagram which involved the professionals as well as us, but clearly the consequences were much more significant for us.
Mm-hmm. Mm-hmm.
And then the last theme I just again wanted to bring out of your evidence is the issue of how the information was given to you that your sons had been infected with HIV. And we've heard from Elizabeth seeing the names on the refrigerator in the treatment room. We've heard from you, Brenda, that your son was told at a relatively young age and you were not. Mm-hmm. And then we've heard from you, Linda, that you and Michael were told, but told much later on and not even knowing that that was what the meeting was about. The way in which you were told this news, and it can never be good news, it can never be anything other than a terrible thing to hear. But do you have any reflections on the way in which you found out?
Well, I think maybe the parents, in the case of children, parents should have been told before the child so that we could be prepared to help our child accept and take on board that information. Whereas we didn't even know he'd been told, and we couldn't understand why he changed so much and lost interest in everything that he loved before, because he thought he'd got no future. So I think, we weren't given any tools to help him cope with it, which, is really difficult. I think we had our suspicions that he was infected, but taking that decision to actually physically go and ask was a difficult thing to do. So maybe I did shy away from doing that until I saw it written down in his notes. But I think it could have been handled a lot differently,
Linda?
Well, I think when I was told it was done in a cold way, no emotion, or it was just like he was just reading it off a page, you know what I mean? No feelings about it. It's the way he was. I'm afraid, that doctor, But I was just annoyed with that gap. What I spoke of.
When you thought everything was all right.
Yeah, for a year and a half, we just kept thinking, he's all right, because they found out about it, that this virus was about in some of the treatments. We just presumed we were all right for all that time.
I mean, I just find it unbelievable the way they sent a letter out telling someone of the hepatitis infection to a teenager for a letter just to drop through the letterbox with no warning whatsoever. I think that was pretty disgusting, to be quite honest.
I think the difficulty was that the emotional and psychological impact of that information wasn't accounted for. And the thing that I find very difficult is that everybody who was working within the hospital would have known information about my son. that I didn't know. And then that undermines trust because you don't know what people are thinking to whom you're talking. And we used to have to interact with a lot of different health professionals depending who was on duty at the time we were taking the children in. And so it undermined trust generally, I think, which had knock-on consequences then when we're dealing with a much more difficult scenario.
Yeah, we used to take them to the dentist at the Children's Hospital, didn't we? It was quite possible that the dental department knew more about our sons than we did, you know, and other agencies that you come up against as well.
Yeah, I think another annoying thing is that because Michael was a teenager and not known for a year and a half, he could have passed it on.
Could have passed it on to you or to
He could have passed
friends
it
and
on to
girlfriends.
me even. He could have passed it on to friends. You know, he did have a girlfriend then. He was just sort of leaving school. But fortunately, they didn't do anything like But I mean, he could have passed it on because we wasn't told.
He was, I think you said he was 16. He was actually 17 when he was told. And he knew,
Yeah.
or that they knew, when
Yeah,
he was
he
50.
didn't know till he was just 17.
Those years, during those years, did he have a girlfriend? He had one at 16, plainly. You just mentioned that.
He had a girlfriend when he was at school, finishing school. He had two girlfriends, but the second one we were talking about before. But the first one, I mean, everything was fine, but it might not have been. That's what I'm trying to say.
and the hospital wouldn't have known that everything was fine.
You know, it's like he should have been told whenever he was infected, but we don't know when he was infected.
I'm just going to check behind me to see whether the legal representatives for the witnesses have anything further. Before I ask each of the witnesses if they have anything to add, sir, do you have any questions?
No, I've asked the only one I had in mind when the opportunity arose just a moment ago.
I'm going to ask each of you then if there's just anything you want to add. Elizabeth?
Yes, I'd so like to thank you for the tenor with which you've conducted these inquiries, because I think it has helped me and my family a great deal to be looking in detail at some of the really difficult things that are way past in our history. And I would like to say to those in the Department of Health and elsewhere from the past that this would have been much more useful to me if it was 20 years ago. And part of the difficulty is in the distance of time is accessing records and so on, which may not be so easy to access now or may have been destroyed. And so I would like to see in any future changes that happen as a consequence of this inquiry that patients or their parents, for the time being, have access to all the medical records and are able to write in them, because I think some of the oversights and mistakes that were made could have been corrected at the time and therefore had less of a consequence. And I would like, when institutions decide that they wish to destroy records, that the family or the patient has the opportunity to be given those records to hold, even if the institution is not going to continue to hold them. Because I think for families that have long-standing conditions and maybe hereditary conditions, there may be quite a lot of learning available within those records that they do wish to keep. And then if there is a long delay to a subsequent inquiry, they would have access to those records. Thank you.
Thank you. Brenda, is there anything you would like to add?
Yes, I'd just like to say that coming here today was a big decision for me, because for 25 years I haven't spoken about this in any depth to anyone. Not even my daughter really knew the full facts, or our families really. My side of the family did, because there's haemophilia in my To talk about it, I'm hoping to get it out will have been therapeutic for me, and it's given my daughter a greater understanding as well of what happened, because she was 8 years younger than Andrew, and we did try to shield her from a lot of what was happening, because I didn't want it to blight 2 lives. I wanted her to have her life and, you know, be successful and have a happy life. So, you know, finally, she's becoming, you know, knows a lot more about it. And I'm hoping it will have helped me to sort of put things to bed maybe a little bit. And maybe I can talk about it a bit more. But, I mean, my mother was, Andrew was her only grandchild for 8 years, and he was the light of her life. And she really suffered, and she died 6 months after Andrew died. I think, you know, it did have a big effect on her as well. So it's, you know, we can't change the past, but I'm hoping that some good will come out of all of this now. And like Elizabeth says, people in the future won't have the same mistakes made, that things can be handled differently.
Linda, is there anything you'd like to add?
Well, I just hope that we get some answers at the end of the day after all this time, because it's took too long in the first place, you know. We just need some answers, and just we don't really know now what the answer is going to be, do we? Who's at fault, or why did it happen, you know? And I just feel very proud of my son, the way he handled it, you know, and I just miss him that much. I don't know what else to say. It's just ruins your life.
Yeah,
Ruins your life.
Yeah, it does ruin your life. You never ever get over it. It's like a black cloud. It's always there in your mind, always. Never ever goes away.
Thank you.
Okay.
Sir?
Well, I would just like to say a few words. It is, you should know, it's been deeply impressive to me to sit here and to listen to you and the way you have, first of all, been here, despite, and you've said as much, Brenda, despite your misgivings, you, as it were, brought yourself to do it. And no one who has watched could fail, I think, to see that at times you have struggled with your own emotions, each of you, in your own way. And I'm glad that the inquiry has been a place where you could feel that you could express your emotions if you wanted to. And you have each attempted to be as constructive as you can be, despite everything that has happened. And in many ways, your testimony has been the best testament to your children. So thank you, each of you.
So we have two more witnesses, in fact, our anonymous
we'll
witnesses.
take a break
if
first,
we could take the
won't we?
break. And just as a reminder to those listening, there will be no live stream, Zoom, YouTube access to this afternoon's remaining evidence.
Yes, I shall make an order. I have made the order, but I shall read it out and describe it to you, as I always do, when we come back at 3 o'clock to hear our next two witnesses. But in the meantime, please just remember not to take photographs around this hearing room, just in case you happen to catch someone you shouldn't.